Good evening, everybody, and thank you so much for joining us tonight. My name is Sheela Roth, and I am the head of clinical education at Pearl. I have been here about 4 years now, and I'm excited to share with you a little bit tonight about how Pearl can really help enhance your patient experience. In this webinar, we're going to be talking about consumerism in dentistry, a very interesting topic. And I think it'll be a great way for us to sit back and listen to a completely different perspective from a patient side. And what I mean by that is Justin's going to walk us through what we think the patients want, but in reality, what they really want in a basic, A to Z, that patient experience. So I'm really excited to hear Justin talk. Justin is one of my mentors, so I'm really thankful that he is here this evening. He has an incredible career, been very distinguished in business development, began in the telecommunications industry, as well as working in the past with medical devices. In 2007, Justin founded 7 to 7 Dental, and his mission was really to kind of revolutionize the dental care visit experience. So he is now, 300 full-time employees, Justin, that you have now, and really kind of leading the pathway into this new scalable approach onto almost his 12th office now. And I think tonight we're going to learn a lot about best practices, best policies, training, really from a completely different perspective, which is like the inside out. One thing I will tell you tonight that is really kind of unique is I've known Justin for quite a few years, and what I appreciate most, amongst many things, is that when he's talking about a system and he's talking about what is actually working for his team, he has tried it, he's developed it, and he's proven it, and he's made it scalable. So Justin, thank you again for spending your time with us tonight, and I look forward to hearing from you.
My pleasure. Thanks, Sheila. I appreciate you having me. Well, like Sheila said, my name is Justin Koch. I'm the founder and CEO of 7 to 7 Dental. We've got coming up on 12 practices here in the San Antonio and surrounding area. Started back in 2007, designing and developing the practice, opened our first office in 2008. Kind of a slow growth in the beginning, wanted to create systems that were scalable before I just went out there and started going nuts. So that's what I'm here to talk to you about today. I love this quote from Sidney Harris. It's we all hate change, but we all want the change. We all want what comes from change, but we just don't want to do it. And I'm kind of talking about that's really what I'm going to be talking about today in our industry, because I feel like we've been doing the same thing over and over and over again, decade after decade, kind of expecting new things to happen from the same actions and activities. So the word consumerism it's kind of a unique thing to talk about in dentistry, and many of you are probably wondering what that really means to you and what it means to your practice. So before your patients become your patients, they are consumers. And I know that's hard for us in a world of millimeters to sometimes zoom out from our chair and look at that mouth that we're working on as a person. And that person, more importantly, is a consumer or a customer. And what that person is looking for is, and how they find what it is that they're looking for is dramatically different today than it was even 5 years ago, especially 10 years ago or more. 10 years ago, if you wanted to buy something, you would get up, you'd put on your clothes, you'd get in your car, you'd drive to a retail store, and you would buy whatever it is that you needed. And you'd go back home. If you didn't need it, or you didn't like it, you'd have to take it back to the store and return it. And, and that was the norm. And you can see in just 10 years what Amazon has done to that experience, to so many retailers. We've lost a lot of retailers over the last decade because Amazon has modified and they have revolutionized the consumer experience. Or think prior to COVID, did you ever think you could get anything that your heart desired delivered to your front door within minutes? And now today, where you probably had never even thought about having somebody bring you your groceries to your front door. About the only thing I recall getting prior to COVID was maybe a pizza. But now you've got Uber Eats, you've got DoorDash, you've got a million things that'll bring just about anything. And then you've got Amazon. I'm guessing most of you have probably picked up an Amazon package from your doorstep as late as early as today. So if you think about business in general, the most successful businesses in our country are constantly looking at their consumer, not what they're doing right now or what it is that they're providing to that consumer. They're actually keeping a close watch on the behaviors of their consumers and how their consumers are finding them, and then they're doubling down on that. And so what I find funny in dentistry is we don't look outside of our industry for success stories and what it is that other businesses are doing to be successful. We look at what other dental practices are doing, and we tend to copy what they're doing. And in my almost 20 years of doing this, I find that a lot of dental practices tell, very, I would say, fabricated stories about how well they're doing because they don't want to be viewed as unsuccessful in their industry. And so everybody just kind of does this wash, rinse, repeat approach to successful dental practices, or should I say a dental practice, in many cases not successful. I'm sure many of you on this call have very successful practices. I'm not taking that away from anything that you've accomplished in your career, but I'm sure that many of you are probably on this call trying to figure out how you can elevate your practice or take it to a level, or in many cases, figure out how you can get it to a point where you're actually making a reasonable living for all the effort that you're putting into your practice. So what I'm going to talk about today is really what it is that most typical dental practices give their patients, what patients are actually looking for in that experience, how you can take this knowledge of your patients and create immediate opportunities within your practice. And I'm really going to kind of take it from the easiest things first to the more complicated things that may seem out of reach, but if you really think about it, they are not. And then effective financial case presentation. I think this is an area that's fumbled quite frequently in an average dental practice. And then I'm going to leave it up. I'm going to open it up for question and answer at the end. So let's get started with, what most offices typically give patients. So the number one thing that I see typical in medicine in general, not just dentistry, is it tends to be a very provider or doctor-centric environment. And what I mean by that is we tend to focus how the practice runs, hours of operation, everything within this business ecosystem. It revolves around the owner, perhaps the owner doctor, and what that person wants. And like I said, it's hard many times to zoom out from that millimeter work in the mouth and say, well, maybe this is what I want, but is this what's best for my patients? And this what best for my community? Is this what's best for my practice as a whole? So they get this very doctor-centered thing. And when you really think about that doctor-centric approach to patient care, then you get what I refer to as banker's hours. And many of you are old enough to know what that means. Some of you may not have experienced that because banks have really evolved in their how do they get to people where they are and where they want to be. But back in the day, banks were open 9 to 3. And many dental practices do that today. They're open, 9 to 3, 9 to 4, maybe 9 to 5, Monday through Thursday. If you're lucky, maybe half a day on Friday. And then there's a lot of red tape for these patients to get into the practice because all of these policies and procedures are set in place by the doctor. And then the next thing that many people experience when they walk into a medical facility is a waiting room. I know that sounds silly because every office has got a place where patients come in. But in my organization, I do not refer to them as waiting rooms. I refer to them as a lobby because it is not a holding cell for a patient. And when I think of waiting rooms, I think of just that. That's where they're going to be waiting. But if we've got if we've got appointment times for our patients, then why are we making them wait? If we don't expect to see that patient when they have created their appointment time, then we should have an open, just come in a free-for-all experience for our patients, because we expect them to be there on time. And if they're not, many times we turn them away. But if we're not on time, we get infuriated if they leave. So if you've got this beautiful beverage bar, coffee station, whatever it is, I'm sure it looks fantastic, but trust me, that is a red flag to patients, because to me, I see a beverage bar in any place that I go, and that is a telltale sign that it's a distraction for me, because I'm going to be waiting there. And then next, you get a lot of dental speak. And by dental speak, I'm talking about vernacular that is not in the language set of our patients. So in dental school, I know that the universities require you to speak very, very clinical in nature, but that's part of dental school. And then when you get out, everyone in our world speaks the same language except for the people that we're caring for. So our dental assistants, our receptionists, our hygienists, all the people that we work with, they understand all of the terms that we use, but our patients don't have a clue. Even as simple term like radiograph or prophy. Prophy it could be a million things. They don't understand what recurrent decay or interproximal decay or incipient lesion or caries. They don't know what any of those terms are. And we continue to use those terms and then ask if they understand everything, and they just sit there and shake their head with absolutely no idea what it is that you're talking about. And then when they leave the practice, you go ask whoever presented that treatment, well, what happened? And they're like, I don't know. They said they had to think about it. And next, in medicine, because of this horrible thing called insurance, we create this very transactional experience with our patients. So when we call to schedule an appointment, typically one of the very first things that's asked of this patient, many cases, a brand new patient, is, what insurance do you have? And that changes that relationship like that. That patient is no longer somebody that you're going to care for. They became a transaction. They became an insurance policy that you were trying to extract money from. And it immediately creates a tension between your practice and that patient. And instead of it being a conversation that happens between the patient and their doctor, it becomes a, what does my insurance cover? Because that's what you've made it important with your practice. And then when you make it transactional, you ask very tough questions over the phone that nobody wants to answer, especially somebody that doesn't know you, hasn't met you, and hasn't been to your office, like, what is your social security number? So we make it very transactional with patients. Next, people think that dentistry is very expensive. And I don't like the word expensive, because expensive to a patient means that they're paying more than they wanted to pay for their visit. But when I say huge price tags, I'm not talking about doing cheap dentistry. I'm not talking about doing bargain basement dentistry. I'm talking about creating a way to make dentistry affordable for your patient. And I'm not just talking with Care Credit or any of these other third-party financing. I'm talking about, in many cases, phasing their dentistry in such a way that makes it affordable to them within their budget and their time frames. And then next, this is my least favorite word in business from patient facing, and that is the word policies. So we talk about in our industry all the time about policies and procedures. Those are things that we put together internally in order to run an efficient day. Those are things that we have to answer 90% of the things that happen in our day. But one of the worst things that happens, and I hear this and I see this everywhere, not just in medicine, but any business to consumer environment where a consumer wants to do something and it is outside of the guidelines of that organization. So the response to that consumer is, I'm sorry, that's our policy. And dentistry has lots and lots and lots of policies for some reason that make it put a lot of friction between the practice and the patient. So if that word gets used in your practice between your team and the patient, that's something that should easily and immediately be retracted from your vocabulary. And then limited hours of operation. I spoke about this in the beginning. We tend to force people to make themselves available to us instead of us making ourselves available to our patients. And the reality of it is, and this isn't the case for everybody, but most of the people on this call probably deal with some insurance or most insurance in some form or fashion, whether it be PPOs or capitations, Medicaid in some sort, but primarily I'm talking about the PPO patient. The PPO patient has that insurance policy most likely because they are employed with somebody that provides that to them and subsidizes that insurance policy. So the way that we work is, hey, I need you to leave your job to come see me because I'm more important than you. So you need to leave your job to come do what it is that you need to do in my practice. And then finally, there's this level of confusion, and patients walk out of practices on average, the average case acceptance, and I know that many of you on the call are going to say, that's crazy, my case acceptance is 100%. But if you look at the average case acceptance across all dentists, all general dentists in the United States, that includes early career dentists, late career dentists, is about 25% and 25 to 30%. So that means that 70% of the people that you talk to are walking out of your practice. And I'd be willing to bet that most of them, and you're told in most cases it's because they don't have any money. The reason they left is because they're confused about what was needed. They're confused about urgency. They're confused about payment options. They're confused about how their insurance works. They're confused about so many things. So instead of saying no, or instead of making a decision, they say, let me think about it, and they walk out, and you either don't ever see them again, or you see them again in 6 months for the cleaning because the cleaning doesn't require any effort to understand it. So I'm going to come in, I'm going to get my teeth cleaned. I'm going to continue to push off the stuff that I don't understand because I don't necessarily trust them, because it wasn't explained to me in a way that makes sense, where I can make a rational, emotional and rational decision on to move forward or not. So on the flip side is what patients actually want. And I put great providers up there. And the reason I say that is because nobody goes and Googles and said, I would like to have a mediocre dentist to do my work. They assume. So there's an expectation of level of provider when they choose you. Now, we know that that's not always the case, and not all providers are created equal, but that's an expectation. And I'm going to put this into marketing terms a little bit. It's actually quite humorous when I see marketing pieces that talk about the level of clinical expertise or the level of clinical work that the provider does, because basically you're saying you're touting what it is the patient already expected you to have, which is a level of this expectation of you being a good provider. Second is accessibility and convenient appointments. And forever, I've heard this at seminars, and I've heard other consultants talk about this. They talk about creating this level of exclusivity. And if you create this level of exclusivity, people are going to want to be in your practice. And the funny thing about exclusivity is it will work in some circumstances for certain tiers of people and certain groups of people, but for the masses, exclusivity is not an attribute. Convenience is an attribute, especially in today's world where everything is so easy, everything is so at your fingertips. Exclusivity is not an attribute that you want in your practice. And if a patient calls your practice, they do not expect to be told that it's going to be weeks or months to get into your practice for the most basic of services. Next is affordability. And again, affordability is not cheap. Affordability is not free. Affordability is doing things in a way that allows your patients to get the care that they need in the way that they need to do it, whether it be through financing. But how many times have you attempted to use Care Credit or a third-party financing entity and the patients decline for that? That doesn't mean that we have to deny this patient care. It just means that we need to take their care a little bit slower or a little bit different. We need to phase their dentistry out in a way that's doable for them. And then knowledgeable. The funny thing is they expect everyone in your practice to know everything about your practice. They don't expect us all to be on the same level of dentistry, but they expect everyone in your practice to know about your practice. So if you've got certain things and things about your practice, you need to make sure that everyone on your team knows those things. If you have a membership plan, if you've got a whitening for life program, if you do in-office whitening, whatever the case may be, whatever it is, what procedures as a provider you provide to your patients, what you do and what you don't do, they expect your team to know those things. Clear communication and transparency. When I talk about clear communication, I'm talking about talking in terms that your patients understand. Like I said, removing the dental vernacular. And so if you're talking about caries, we're effectively talking about a cavity. And not everybody, but most people that are going to the dentist know what a cavity is. They've heard that term many times throughout their life, but they don't know what caries are. They don't know what lesions are. They don't know what current decay is. So talk to them as if you, like before you went to dental school, you didn't know any of those things. Talk to your patients that same way. And then transparency about how things work. For my organization, we present a very clear and concise treatment plan with payment options ahead of doing any dentistry for patients. I've been told on numerous occasions, patients that go in and they're saying, hey, we're going to do this crown for you today. And they're like, okay. And then they get finished and they're like, that's going to be $1,200. That's sticker shock. And, you know, that's a reasonably priced crown for sure. But when you're not expecting that, and that's when patients get frustrated, when the transparency is not there and how you communicate to them or what you're going to be doing for them, how you're going to be doing it. You got to be very transparent with them. And then your facility needs to be clean and modern. And clean and modern is important. And so cleanliness is godliness, especially in medicine. And if your office is not clean, if your floors are not clean, you know, I chuckle when I walk into practice. I go into practice quite frequently, and when I walk into rooms that are considered the hygienist room, and that room looks like a shrine to their family, and they've got trinkets and pictures and all kinds of stuff all over the operatory. To me, that is unsanitary. And first of all, it's not very professional, but it's also very unsanitary. Just one more thing to capture dirt and dust and aerosols. So make your operatories clean, make your operatories minimalist, make your office clean. And you don't need big fancy offices, because trust me, that doesn't impress your patients. When they walk in and see waterfalls and, you know, marble all over the place, they're just thinking about how expensive this is going to be. So clean and modern. And by modern, I mean using technology that is going to elevate their experience, right? Technology such as Pearl. These are the technologies that help create an experience that your patients are looking for. And then a caring and courteous staff and doctor. So if you look at your Google reviews, which I'm sure most of you have hundreds, if not thousands of them, you're never going to find somebody that says, man, this was the best. This crown has the best margins I've ever seen in my life. Or wow, look at the contacts on this crown that I just got from this doctor. No, if you look at your reviews, all of the ones that are in the high star level are everyone was so kind, everyone was so courteous, they got me back on time. They're all about how the patient felt, not about the work that you did, especially if you don't hurt them during that process. It's never going to be about your work unless they spent tens of thousands of dollars on a new set of veneers. But on restorative dentistry, they're not talking about your work. They're talking about how your practice made them feel. And then probably one of the most important things is timeliness. I spoke about this a little bit. For some reason, medicine seems to think that our timeline is different than our customers, and they should wait on us because we're that important. That's not even close to being true. I mean, how many times have you gone to your primary care physician, sat in their lobby for 45 minutes just to be called back to be taken to the next holding cell for another 30 minutes to sit on a super comfortable bed chair that has a piece of paper on it just for your doctor to come in and speak to you for, 3 minutes? It's timeliness is very, very important in what we do, and it's what our patients want. They made an appointment for a reason. They showed up on time for a reason. They expect us to keep that time frame. I understand there are times where emergencies happen and things, but when you cannot meet the expectation of your patient with their time frames, that's where we come back to the clear communication and transparency. you need to communicate that to the patients that are waiting as exactly what happened. And so with those things kind of being said about what patients want, what patients need versus what they get many times, I'm going to talk to you guys about creating some immediate opportunities in your practice with some of these things. And they start basically from the easiest to the most difficult. And number one is creating an annuity. Second is minimizing the obstacles to entry. Do unto your patients as they want done to them, assisted hygiene, and then extended hours and days of operation. So let's start with creating an annuity. This one is going to be the easiest thing you hear me talk about all night long, and that is the word next. It is a word that we use all the time in our organization. It is, we talk about it between every single person in our organization, and it is, does this person have their next appointment? And I know it sounds like very simple things, and many of you believe that you have a great high percentage reappointment rate for your patients. If you think you do, I highly recommend that you track it. And you will find very quickly that your reappointment rate is probably not as high as you think it is, because if you're not tracking it, nobody will care about it as much as you do. But if you're tracking it, all of a sudden it will improve. And when I say every single patient leaves with an appointment, I'm talking about every hygiene patient, every emergency patient, every post-operative patient, every crown seat, every delivery, because one of the things that we miss so frequently are the people that come in post-treatment when they get their delivery done, when they get a post-op after a complicated surgery. And what's their next visit? Well, if nobody knows what their next visit is supposed to be, it's going to be very hard to schedule that patient. So every single person that walks through your door needs to leave with a next appointment, whether it be a next clinical appointment, whether it be with their next treatment, whether it be hygiene, whether it be with a post-op, a crown seat, a delivery, because every single time you reappoint them, they will make their way back into your practice. And every time they show up, it shows they trust you a little bit more than they did last time. And then they will be a part of your practice. And I don't consider patients a part of my practice until they're in my hygiene department, because now they're just passing through otherwise. So every single patient gets their next appointment, and you need to start tracking that if you don't. Number two is minimize every obstacle to entry. This is what we're really bad at in dentistry. We create so many friction points to get into our practice. It's unreal. And so the first point of friction in so many practices is answer the phones every single time. And I hear a lot of times, well, I don't have enough staff. Get more staff, because every single time you do not answer a phone, you have the opportunity of missing a new patient appointment, because in today's world, they will go to the next one. Google has 15 dental practices sitting right in front of them that are dental practice near me. And the expectation is they're all the same. So they're going to call the next one who does answer their phone. So if you look at the average lifetime value of a patient, it's in the tens of thousands of dollars. Every phone call that you miss is a potential $10,000 lifetime value of a patient, or very likely $1,000 first visit. So if you do not have enough people to answer every phone call, you do not have enough phones, you do not have whatever it is, fix it. Answer every single phone call. No insurance questions on that first phone call. I know your team's going to reach out and say, absolutely not, doc, we can't do that. We have to verify their insurance before they get there, because what if we have to do a treatment plan? Who cares? Insurance does not take that long to get basic insurance verification with all the insurance portals. You don't have to know every in and out of this insurance policy from the very beginning. To be able to schedule them for their first visit, which is typically going to be a cleaning and exam and some x-rays, all you need to know is, are they eligible for insurance benefits? And that's it. And are they eligible? And does this insurance work in our office? That's it. And it's a very simple thing. So don't ask those insurance questions, and mostly because it creates them as a transaction instead of a patient. It makes us ask very uncomfortable questions over the phone, which people do not want to give us. If I ask you for your social security number and date of birth right now over the phone and ask you all to just message it to me through the chat, I'm guessing I would probably get that 0 times, but we expect our patients to do it regularly. And then exclusivity, like I said, is out. That is not a thing in our world. So any appointment within a day. And I know you're probably shaking your heads going, that's absolutely impossible. I can't do that. Trust me, it is. There's more room in your schedule than you think. And if you need to if you can't get them in within a day, you need to reevaluate your staffing, you need to reevaluate your operatory configuration, or you need to reevaluate, how do I actually schedule these patients? Am I overbooking time? Am I utilizing my operatories effectively? Or if you can't get somebody in with a day, that means you are at critical mass, and it is a good time to look at expanding your practice. And I promise you, you probably have room in your practice to add an operatory too, because most practices are not created very efficiently to maximize space for operatories. And remember, operatories are the only place you make any money. You don't make money in waiting rooms. You don't make money in doctors' offices. You don't make money in managers' offices. You make money in operatories. So if you've got this extra space and you can't get an appointment within a day, turn one of those rooms into an operatory. And then talk to your patients like you actually want them there. I get infuriated when I walk into my doctor's office and the receptionist won't even look me in the eyes. And when I finally get up to the front desk, all I want to do is ding the bell, which isn't there, because they won't even look at me. And then when they do, they look up at me as though I'm an interruption to their day, as opposed to the reason for it. Just remember, our patients aren't lucky to have us. We're lucky to have our patients, and we need to treat them that way every single time they come in, from the very first phone call through the clinical treatment, through the insurance portion, through the accepting of their money. If we promise them we're going to give them a phone call back, we've got to make sure we give them a phone call. Otherwise, we're just lying to our patients. So we got to talk to them like we actually want them there. And then do unto patients as they want done to them. So let's start with what patients want when they come into the practice. Many times you'll ask them, what brings you in today? And they'll say, well, I'm just here for a free cleaning, or I'm just here for a cleaning, or whatever the case may be. Probably the worst words you can ever hear as a practicing dentist is, I'm just here for a cleaning. But the reality of it is, that's what they came in for. That is not necessarily all they need. But if they come in and they ask you for something very specifically that is outside what you would say, that wouldn't be my first priority, if you can give that to them and it's clinically acceptable to do the thing that they want first, do the thing first. Because if you ignore their request and go straight to what it is that you want to do to them, they're not going to trust you enough to do any of that. Not only did you miss what they wanted, but you're going to miss what it is that you think they need. But if you give them what they want, they'll trust you with what they need. And then that cycle goes on. That's where the referrals come from. Start with what they want if you're clinically able to, then address their immediate needs second. Communicate like a human being. Talk to them like a human being, not a clinical professional. And then if you work in an organization with multiple doctors, you need to make sure that you guys are calibrated on your diagnosis of patients. And I'm not saying you have to be exactly the same, but if you're in different chapters of different books, this can be very, very, very confusing for patients. And it can really create a lot of trust barriers if one doctor sees them one time, another doctor sees them the next, and completely revamps the treatment plan. And the patient's like, well, last guy didn't say I needed any of that. You're telling me I need all this. So it's important that your providers, that includes your hygienists and your doctors, are very similar in their methodology on how they diagnose and how they treatment plan patients. And then we need to be good stewards of their money and their insurance. Look, I know we all hate insurance. There's nobody on this call that says, man, I really love my patient's insurance. It is an absolute scam. We all hate it. It's the worst thing ever. But guess what? Our patients have a weird love of this really crappy dental coupon. And if you do not treat their insurance as something that is useful to them, and you tell them that it's ugly, like you would never tell your friend that their baby's ugly, even if it's the most horrific thing you've ever seen, because it's your friend's baby. So you say, oh no, it's gorgeous. I love your baby. It's beautiful. You say the same thing about their insurance. You say, hey, we love Delta Dental. We don't love Delta Dental. We hate Delta Dental. But we tell them we love Delta Dental. It works great in our practice. And the reality of it is, you need to make sure that it works as good as it possibly can for the patient, because any dollars that they don't have to put out of pocket to get their dentistry done is more dollars they're going to spend with you. And then we need to make sure that we are utilizing their insurance to the fullest so that their out-of-pocket expense is as little as possible. So being good stewards of their money. And then patient care, not a transaction. And I've talked about this a few times tonight. When you transactionalize this, that's when we stop making it about patient care and we start making it about insurance policies, about fee schedules, about all this kind of stuff. So focus on the patient care. All of the other stuff is part of the process, but it is not the reason for it. And then a moderate financial presentation. This is breaking down extensive treatment plans into digestible chunks for your patients. Because I see this so often where a doctor will go in with a new patient and they'll just call out a bunch of letters and numbers. It looks like alphabet soup, you know, MOD, crown on this teeth number, that, blah, 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 recurrent decay, redo crown on this tooth, blah, blah, blah. And then your assistant or your OM or your treatment coordinator goes back and puts a treatment plan together because there was no urgency or there was no actual priority set for this patient, or even talking to them about how they wanted to begin or where they wanted to go first. And this person goes and presents a treatment plan of $7,000 to a patient who just came in for their cleaning. And I promise you, that patient ain't coming back because they get overwhelmed and they don't understand that this can be broken down because it wasn't shown to them in that way. So modern financial presentation, address patient, oh, I've already talked about that. So now this is the third one on the list. This is assisted hygiene. And when you say we don't have room to get patients in a day, this is the easiest way to increase your volume of hygiene. And I know hygienists on this call are probably going, absolutely not. I can't care for patients this way. It's awful. It is not awful. It is one of the greatest things that you can do for your patients, for your practice, and for your community, because assisted hygiene is not about seeing more patients faster. It's about seeing more patients more efficiently by using an assistant to help in that process. You would never see a dentist working independently from an assistant. And that's what allows doctors to be so effective. However, hygienists are very resistant to working with an assistant. You don't need a full hour to see a patient if you're not bringing the patient back, if you're not taking their x-rays, if you're not initially going through their health history, if you're not turning your room, you're not sharpening instruments, you're not sterilizing instruments. Your focus as a hygienist is to do what your license allows you to do. And then you have an assistant whose license allows them to do these other things, which allows you to care for more patients, which allows you to open your schedule, schedule more patients without having to make the initial investment in hiring another hygienist that perhaps might just be sitting around all day long. So my goal is to see, for my hygienist to see on average 2 patients per hour, but they're doing it only doing the patient portion. That's the education and the pro fee. And my assistants do everything else. This is the quickest way to increase your access to care. And for every hygiene patient that you bring in versus what you're doing right now, if you look at your average dollars divided by your hygiene patients, you'll see that it's probably somewhere between about $700 and about $1,200 per hygiene patient seen. So every hygiene patient that you grow your practice, you can assume that if your average is $800 to $1,200, that's going to be an additional $800 to $1,200. And I'm not talking about in hygiene production. I'm talking about an overall production per hygiene patient. This is a phenomenal way to be better for your community, get your patients in and give them what they want, which is access to care, quick turnaround time, and it allows your hygienist to work more efficiently, which gets your patients in and out of your practice in about an hour, which I promise you they don't want to be there any longer than that. They don't like our offices to begin with, and they certainly don't want to spend a bunch of time in there that they don't have to. And then right here, this restaurant is closed during the middle of the day. And when patients or during the times when people want to be there. And I feel like that's what we do with our practices is we pay rent on a building or a building that we own 24 hours a day, 7 days a week, 365 days a year. And we operate out of it 30 to 32 hours a week. And not just the mind-blowing expense that comes with that, because as you utilize that space more, your fixed cost for that rent continues to go down and down and down, which means your profit goes up and up and up. And then you're only able to care for your community in the 32 hours in which you're there, which, as I said earlier, most of those people are at work or their children are at school. And so the idea that people are going to come to you because you're the best dentist in town it's a fallacy, because they don't know you yet. They have no idea that you might be the best dentist in town. And who's to say you are the best dentist in town? I don't know, but give them access to your practice and I promise they will flood it. But the one thing is don't expect your existing team to take on this additional workload, because if you say, hey guys, great idea, we're going to open up Fridays and Saturdays and all of you just need to suck it up and work more, you're going to lose your entire team. You have to hire people to take up this load. And as a practicing dentist, me saying work more days, I'm not talking about you. I'm not saying work harder, work more, do better. I'm saying utilize your space more effectively. Hire a dentist as an associate. There are some bad dentists everywhere. Practice owners, associate dentists, you name it, there's bad dentists. But guess what? There's a ton of good ones too. And then if you hire an associate, you can train them to be the doctor that you want them to be in your practice. And then guess what? You double the access to your practice. And don't work side by side with this dentist after they're trained. Open up your schedule and let more people in, and then utilize your space better. It's a phenomenal way to grow your practice without having to go open another office. Just use the hours that you have better. And then I'm going to go through some ideas on effective case presentation. And this is going to be counterintuitive to some of you guys. I know a lot of you guys have probably been to some of these, Spear and Hanky and all these kind of stuff where they talk about how to present $40,000 treatment plans. Okay, that's great. But let's talk about who's actually the person presenting this after you leave the room. Is it the least busy person in the practice? Is it the one that's scared to death to present money? And I will tell you, most people in your office that are not you, many times even the doctor, are fearful of larger treatment plans. But if they're nervous about presenting money to patients, they are also going to project that onto the patient, and the patient's then going to get suspicious of this. So I talk about treatment coordinators all the time. If you don't have treatment coordinators in your office, and when I say treatment coordinator, I'm not talking about somebody that also works the front desk, also verifies insurance benefits, also does all of the other administrative tasks. I'm not talking about that. I'm talking about a dedicated and realistically sales professional. And I know people don't like that word in medicine, but it is literally a dedicated sales professional. Somebody that can sell this pen. If you've seen Wolf of Wall Street, you know what this is from. You need somebody that can take your guidance from the diagnosis and the original treatment plan and finish it. Taking the patient from in the chair to on your schedule and paid for. So you need somebody like this. But the reality of it is, how do you present this dentistry? You just throw a bunch of shit at the wall, a bunch of stuff at the wall, and hope something sticks. And I find that a lot, especially in early career dentists. They just throw. They just say a bunch of things, throw it at the wall, and see if anything sticks. They don't really have a plan of action for all the dentistry that they identify. And this is where patients get confused. They get frustrated. They don't know where to start. And if they don't know where to start, they typically leave and they say, well, I'm trying to buy a house, or I'm buying a car, or I'm about to get married, or my kids are doing this, or it's almost Christmas. They'll come up with a million reasons not to do the thing that's actually most important, which is their dental work, because it's not because of any of the things they said. It's because they don't understand anything that you told them. And so it's putting a logical, reasonable treatment plan together that makes sense for them, creating urgency, not made up urgency, but creating urgency on the most important things. And I always tell patients when I'm talking to them on the treatment planning side is look, this didn't happen overnight, and we don't have to fix it all overnight. But the one thing we have to do is we're going to go on a journey together, and every journey starts somewhere. And based on what you and Dr. Jones talked about, the best place to start is right here, because this is the most critical thing that's happening right now. And this is where we need to start. So you got to start them off somewhere. And really, the greatest thing about dentistry is if you do the first thing and it went really well, they're going to be way more apt to do the next thing, and then the next thing after that, and then the next thing after that. But in order for them to continue doing the next thing after the next thing, is you got to make sure that you schedule them. every single time. And then I like to compare kind of not treatment plans, but you kind of look at a patient. I look at it kind of like an iPhone. And I know that sounds silly to compare your patients to an iPhone, but I'm not interacting with you guys right now, but I would be willing to bet that most of the audience members tonight have either an iPhone, and I would say probably 90% iPhone, and maybe 5% Android, Samsung, something like that. But these are relatively expensive units. And they're probably, let's call it 800 to $1,000, which I still have a problem with that, but however I paid it. But if, and I am one of those Samsung users, I'm the guy with the green bubble. So I'm sorry to all of you Apple users, but if I went to buy a Samsung phone or an Apple phone and they told me it was going to be $10,000, I would still be on a Razr, a Nokia Razr, or maybe my 6210 brick phone from Nokia, but I certainly wouldn't buy a $10,000 Apple phone. But what I can almost guarantee everybody in the audience tonight has done is spent tens of thousands of dollars on Apple watches, Apple phones, iMac or Mac computers, Apple accessories for yourself and your family. And you've done that over the course of years. So if you kind of look at your patients the same way, it's like if I can throw a $10,000 price tag at them, and once in a while I'm going to catch that whale. But 90% of the time, 95, 97, whatever, they're going to walk out of here going, you must be out of your ever-loving mind. That's crazy. But that person, that consumer, at the end of 5 years, 6 years, 7 years, could have spent tens of thousands of dollars in your office and referred even more to your practice if you treatment plan conservatively. And when I say conservatively, I'm not saying overlook dentistry, never saying overlook dentistry. I'm just saying that everything does not have to be presented to the patient financially on day one. We take it in chunks, digestible chunks that the patient can and is willing to listen to and is willing to move forward with. And then have a really good person who understands dentistry inside and out, be the person to follow up with that, not the least busy person. And if you have your dental assistants presenting dentistry to patients, that is the worst use of their time, because if they're presenting dentistry, that means you're not doing any dentistry with them. Have somebody that's in that role doing that job, have your dental assistants doing dentistry, and I promise you, you're going to have a much more efficient and effective practice. And then how do you present this treatment after you've diagnosed it? How's it presented to the patient? So I call this the click and print, the hand and hope. So if you've got the least busy, least effective person presenting dentistry, they're going to present this treatment plan and they're going to hand it off to the patient. And it's going to say things like crown porcelain ceramic substrate. Okay, I have absolutely no idea what that is. Or what about a resin composite 3S posterior? Everyone on this call knows that that's a 3-surface tooth colored filling, and everyone knows at the top that 2740, that's a tooth colored crown or a zirconium crown, porcelain crown, whatever that may be. But our patients don't know. And they take this home and they're like, I don't know what any of this stuff is. I don't even know what I need. They can't explain it to a financial partner as to what I need or how I'm going to pay for this. And realistically, there was no conversation about it. So this is printed, handed to them. And most importantly, it has no financial options on it. How's the patient supposed to pay for this? Or you can use something smarter like this that says tooth buildup, tooth colored crown, and then tooth colored fillings on the teeth that we're doing it on. And you can see that it has treatment option or payment options down at the bottom, signature for the patient. It's patient friendly. It removes unnecessary obstacles. It has patient options, convenient ways to pay. And then most importantly, it was presented by a treatment coordinator who's highly skilled in having these conversations with patients. And then let's talk about technology that sells. I told you about modern practices, clean modern practices. Modern doesn't mean that you've got to have the lasers and all these weird things. I'm talking about technology that's going to help your patients and help you become a better clinician and help your patients understand more about what it is that you're talking about. And I want to start with Pearl. So obviously I'm going to do the Pearl plug because they're the ones hosting this tonight. I use Pearl Second Opinion in every one of my offices, And my associates absolutely love it. My hygienists love it. They use it every single day on every single patient that comes through. And the reason that they use it is because it doesn't change their diagnosis. It helps them in many cases where they're like, do I see something? Do I not see something? It takes their eyes in directions, especially when they're super busy and they're running into an exam. It helps them it pulls their eyes in areas that they may not have looked to make a decision on what do I need to do. And then second, if you want to use this as patient education, if you show a patient an X-ray, it is a sea of black and white. I literally heard a patient tell a doctor, they put an X-ray up in front of the patient and they said, wow, it looks like toes. What is that? It was their teeth, but apparently their teeth and their toes look the same to them. But they don't know what it is. They didn't go to school to identify this. They can't tell the difference between a cervical burnout, an interproximal lesion, bone loss versus the black in the back. They don't know what any of that is. So use Pearl to shed some light on these X-rays. It's a great tool, especially when you have somebody that says, well, I was going to my last dentist for 20 years and they never told me anything about any of this stuff you're saying. Well, you bring this up and say, hey, look, this is a large language model that is getting input by millions of X-rays every single day. And it is showing areas that are of real concern. And whether it was ever presented to you before or not, I'm showing you what this unbelievable technology is showing, and I want to make you aware of it. And so it kind of helps make you not the guy who's telling them a story. You're not the shady mechanic that's telling them things that they don't understand. You're showing them through technology. It is a phenomenal tool. I have a lot of early career dentists that work in our organization, and they rely on this all day long, every single day, to make better decisions, to help not diagnose for them, but help them make better decisions on behalf of their patients. And they love it. They tell me all the time that they couldn't live without it, which is funny because they did before I had it. But once you put something like this in front of them, they're not going to let you get rid of it. I promise. And then how about this? And it doesn't have to be an iTero. That's just what we use. But we do iTero wellness scans, or just wellness scans on every single patient that comes through the door. And in dentistry, you have to be a great storyteller. And I'm not talking about fairy tales. I'm talking about you have to be able to look at X-rays, look at a patient's mouth, tell a patient what you see, make them believe that what you see is real, and then help them understand how you can fix something that they don't even see. So how do you do that? And the best way that I've found is doing wellness scans with patients. It's literally like picture books for dental storytelling. If you're not a great storyteller, which not all dentists are, there's some phenomenal storytellers, but if that's not your thing, if you're more clinical in nature and you don't really love that telling of stories to patients, this is exactly what you need. Because what better way than to take their face, rip their mouth out of it in a digital model, put it right in front of them and show them exactly what you see. Fantastic way to create value in your practice. If you do wellness scans, you're doing something that very few, if no practices around you are doing. They will literally be in awe when they start seeing this picture come up on the screen in front of them. And then you show them exactly what you see. And their ability to make a rational decision to move forward increases dramatically through the use of scans. And then most importantly, follow up, follow up, follow up. Like I mentioned earlier, there is 60, 70% of the patients that walk through your door, the dentistry that you've presented to patients is never getting completed. If you've got treatment coordinators, they should be following up with these patients that walked out without scheduling their treatment. But if they walk out without scheduling their treatment, they should always be scheduled for their next appointment anyway, and that would at least be their next cleaning. Never leave without the cleaning. But if you're letting this low-hanging fruit go by, just waiting for the next new patient or the next patient exam to capitalize on, you're missing out on tons and tons and tons of opportunity. And at the end of the day, you're just not taking as good of care of your patient base as you could. And trust me, they're not ignoring you. All your patients are super busy. but they're not going to say yes to coming back in to get this treatment if they don't trust and believe that the dentistry is important and urgent, and they don't trust your practice. So all the things we talked about before this have to be in place. The patients have to trust your practice. They have to trust you, and they have to trust that you're out in their best interest. And then you follow up with those patients. And I tell my treatment coordinators, call, and call again, because until they tell you to stop calling or they answer the call and schedule that treatment, they didn't get your call or they didn't get your text message. All right, guys, thank you so much. That's all I have tonight. I'm going to open it up for questions if you have any.
Excellent presentation, Justin. We are so thankful for all this information. I'm really thankful that this specific webinar is recorded because it's a full dissertation on how to make our practices better. And I'm thankful that you were able to share that with us. I'd like you to take a minute and just look at this x-ray. And imagine yourself going through your very busy day. You know, you prep someone, you put a rubber dam on, whatever the case may be, you got to jump up and do the hygiene exam. And if you have a minute, I'd love you to put the number of caries that you find in this actual image. So take a peek. What areas of caries? Now, if we're talking about it in Justin's terminology, we're going to say, what areas of decay? What kind of cavities are we going to be showing our patients? What I'd like you to do is just see that there's quite a few different areas of decay here. And reviewing radiographs much faster in color is excellent for the clinician. So the click of one button provides your eyes an additional set of data, a great way to talk about incipient lesions, a great way to talk about areas of concern. And really, when we turn around to the patient, hopefully when we're using our, case presentation tool, these patients understand why they might need this cavity filled sooner rather than later, so we don't have to have a root canal. Or maybe they do have to have a root canal and we need to explain to them why, or why we're going to maybe watch these teeth and we need to fill this one. So I just kind of wanted to make sure that you understood how we have the new technology to be able to bring an entire different patient perspective to the audience. And I think that's the most important thing that we have for Pearl. Now, I do want to make sure we're answering questions. So let's see here. I want to tell you my biggest takeaway when I heard Justin speak before was the next visit conversation. So I went back to my practice when I was managing, and we put in place next visit because, in dentistry right now, we have less staff, more patients, hopefully, and we don't have time. So we're just trying to get through what happened in this moment today. And great, we got through that appointment. Let's check the box. Yes, we have good experiences, but there were so many patients walking to the front desk saying, when are we going to do the implant? Or I think they were talking about the bridge. And I thought, wow, that was such a very epic fail on our side because we weren't even thinking about next visit, right? So Justin, what do you think from everything you went through today, your number one key takeaway point that really kind of took your practice to the next level? What would you say if you could implement one thing today?
So I kind of put these up there in order of the easiest things for practice to implement that are going to be impactful. There's a million things I could have put up there, but in terms of impact, making sure that everyone gets their next appointment is because if you miss 10% of your 10% of your hygiene patients, 6 months from now, you just lost 10% of your patient base. And so, and if you're looking at it saying, well, we saw the same number of patients, so we didn't have any attrition, that's not true, assuming that you had new patients. So you've immediately started on the wrong foot by not scheduling every single patient. And then realistically, the most difficult thing that would be for most practices is to transition their practice from a Monday through Thursday, Monday through Friday, to a 6 to 7 day a week practice operating extended hours and extended days. We're open 7 days a week. We're open a full 76 hours a week. And I know doctors are like, well, I tried weekends once. I did, it didn't work. Well, the reason it didn't work is because you got your regular weekday staff to just start working on the weekends, and weekends we're not in your DNA. You have to make a commitment to being that practice And you will find in very short order that Saturdays become by far your most productive per hour day. And I will say that will make the biggest impact in any single practice's trajectory, especially if you can't get somebody in today, open up more days. Because you don't need to go open another office, just utilize the space you have better. And that comes with adding additional team members, adding additional associates or doctors. I mean, it's not easy, and that's why I put it as number 5. But I will say, nothing that's worthwhile is easy, and this is by far going to be the most impactful to any practice.
Excellent. I love that. I couldn't agree more. There are a couple questions coming in. Here's one of them that says, give us another narrative instead of that's our policy. Like late appointments, we ask them to reschedule if they'll be more than 15 minutes late, or cancellation policies. What are your thoughts there?
So I really don't have a cancellation policy. I know a lot of folks have, cancellation fees and things like that. I find that that's I only put cancellation fees on patients that I don't want anymore, because it's kind of a surefire way to get them to leave, because they're not going to come back because they don't want to pay it. But for late, so if you have somebody, and I wouldn't put a policy on time, because if you say if a patient's 15 minutes late, we are not going to see them. What if the next hour's patient rescheduled and you have nothing in that hour, but your hour's patient is 15 minutes late? Are you going to kick them out too? So now you just lost 2 hours. So I wouldn't put a strict policy on that. I would have it in terms of, can we see you still, or can we not? And that is it's more of open-ended. It lets smart people make smart decisions in your practice when the time is right. And if they come in and the next hour has failed, then it's like, absolutely, we're going to be able to see you this time. I can't make a guarantee next time, but we're going to be able to see you this time because we had to make, our next patient wasn't able to come in. But if they are 15 minutes late and you can see them, then I would say do it, because they're already in your practice. They did something that some other people didn't do today, which is just not show up at all. At least they got there. And, it's not my favorite thing when patients are late. I'm a very timely person. I like everything the way that it is. But the reality of it is we don't live in that world. Everybody's kind of on island time, I guess. And so if you can make it work, make it work. If you can't, then you tell them. We would love to see you today. Not it's our policy to cancel you after 15 minutes, because what if they say, well, my appointment was, what's your policy when you're 15 minutes late? Is my appointment free? I mean, because they're going to turn it back around on you. Just say, we would love to be able to see you today. However, this has happened and this has happened and this happened, and I would love to get you rescheduled at another time that works for you. And just so you don't make it about that's my policy, you just come up with a reasonable human being conversation with them. It's just about conversations, because that policy, that is an immediate shutdown. And I call it a professional FU, because you don't have anything more intelligent to say. It's reframing is what it is. And these are great exercises to do in your office on any scenario that you have, is how do I reframe this to be more effective and to actually get a better result than saying that's our policy, or no, I can't do that. No is a terrible word also, because there are many things that we can't do, but no is not a really great word to use.
There are a couple more questions. One of them I wanted to address, which was, how do people really kind of respond to technology based on different demographics? And I'm going to give you one statistic that we have found at Pearl, but I also would love, Justin, if you have any insights. According to some studies we've done, which were surprising to me, but 87% of patients prefer that you have the latest technology. I always thought like, wow, we need to wait for technology to evolve and improve. But I remember going from getting a, impression for a night guard to getting a scan. And I thought, wow, I really want all the technology overnight. So I don't think we're seeing with AI in radiology, we're not seeing any concerns with that. I think when doctors frame it in the perspective that it's a second set of eyes, then they're thankful that there's more data there. And really, when it becomes the patient-facing education, then they really understand like, oh, okay, I understand now. And really, I think the whole point of this is, what if patients actually accepted more dentistry earlier and not more diagnosed, but more that you're actually recommending. So if they just accepted all of the treatment plans that you're recommending, then they're going to be in a healthier position, right? They're going to have the dentistry that you're recommending, less invasive, less expensive, which is usually contributes to a higher retained patient. And we know that cost is over time. I'll let you comment on that, Justin, but one more comment was about our Saturdays fell apart. And kind of what are your thoughts about your opinion on Saturdays falling apart?
Yeah, well, I'm gonna comment on the technology first.
Perfect.
Um, wherever you live, wherever you work, you're in a developed country, and so there are different socioeconomic areas in which you practice in. But I would be willing to bet that the majority of the patients that you service have a smartphone, they have an iPhone, they know how to use technology, they understand technology. Just because their socioeconomics are different doesn't mean that they don't understand those things. And they may not have as much education in oral health care or taking care of all of those kinds of things, maybe how they were brought up, but they understand technology. And when I use the word technology, I'm not talking about toys in your practice. I'm not talking about the things that make doctors happy, like the newest thing. Like I think CEREC is kind of it's cool if you can make it work, but that's not a thing for patients. That's not technology that I think is important to patients. I think technology that's important to them is what helps them become more educated without becoming a dentist in their field so that they can make smart decisions on their dentistry. That's why I love Pearl, and that's why I love wellness scans. I think those are the two most impactful pieces of technology that have happened in our industry in quite some time. Saturdays can be just like any day. Any day can be a day that just fell apart. We've all experienced those days. We love to focus on Saturday because it's Saturday, and for some reason, in the United States, we covet Saturday and Sunday. It's just, to me, it's just a day, and the reality of it is the reason that it's so tough with so many practices is because it's the regular team, and then they work weekends. My teams, because we are open 76 hours, have very flexible schedules. They actually get less time in my offices, not hours, less days in my office. So they get their hours, they get to make their money, and they do it in fewer days. So they don't have to commute to my office 5 days a week. They commute 3. They get to come to and so Saturday is just a day to them because they have 4 other days off. And so it's a nice trade-off that they have. It's like, look, I can get Saturday and Sunday off, or I can get I can get Sunday, Monday, Tuesday, and Friday off. I mean, it's like, what do you want in your life? And so, and if you have that, then the team's commitment to Saturday is the same commitment that they have to every other day, because that's part of their job, that's part of their work, and that's just what they've become accustomed to because they get so much time off outside of Saturday.
So it's great to have everyone here again. Thank you for staying, and we really look forward to seeing you in the future. If you have any additional questions, feel free to reach out, and I can also connect you with Justin if you have follow-up questions. So thank you again for spending your evening with us. Justin, thank you so much for taking the time, sharing all of your wisdom, and I hope everyone has a wonderful evening.
Thanks, Sheila.
Bye.
Thank you, everybody.